plugs or bile lakes or bile aggregates in the canaliculi with rupture of these canaliculi and extravasation of bile. So either intracellular or extracellular bile accumulation, droplets, and سميناها feathery degeneration due to clumps of bile biliary secretion within the hepatocytes. And apoptotic cells and Kappa cells are seen as a reactive process. Bile duct obstruction, the most common cause in adult is extrahepatic cholelithiasis. Cholelithiasis معناها gallstone, extrahepatic gallstone, gallbladder stone. This is the most common cause of extrahepatic biliary duct obstruction. Malignant tumors can be seen in the common bile ducts and also post-surgical or iatrogenic obstruction. In children, there are certain congenital abnormalities like biliary atresia, narrowing of the biliary passages or common bile duct or cystic duct, cystic fibrosis, and choledochal cyst. Choledochal cyst, cystic structure within the biliary passages, congenital cyst with narrow lumen or obstructing the biliary flow. A term called ascending cholangitis. شباب, cholecystitis, inflammation of the gallbladder. Cholangitis, inflammation of the intrahepatic biliary passages. Biliary passages are intrahepatic and extrahepatic. Cholangitis is the intrahepatic biliary passages. So ascending cholangitis is most commonly related to ascending infection, bacterial infection from biliary tract obstruction by a stone. So bacteria like coliform and enterococci are colonize the biliary passages, result in infection that is ascended into the intrahepatic biliary passages, cause ascending cholangitis. Suppurative cholangitis, in which there is pus formation and abscessing cholangitis with severe and purulent bile and obstructing the intrahepatic biliary ducts. And sepsis is a complication, which is a late complication transmitted through the blood, separation and effective focus. Cirrhosis is one of the top 10 causes of death in the Western world, and the characteristics of cirrhosis is the bridging fibrosis. Whenever there is fibrosis, whenever there is laying down of fibrous tissue, so it is permanent, so it is irreversible. Fibrous tissue in the liver, it is a reversible process and is the start of formation of regenerating nodule and as a progressive feature of cirrhosis. There is delicate bands or broad bands of scarring replacing multiple lobules. Two criteria is fibrosis and formation of nodules. Fibrosis between two adjacent tracts, two adjacent portal tract is not called nodule. Nodule require fibrosis through the 6 portal tract of hepatic lobule. And the nodules can be micro and macro according to the type of the hepatic insult. Usually macro, it is called parenchyma regenerating nodule, small if less than 3 millimeter to several centimeter, become called macro nodules. There will be disruption or loss of normal architecture of the entire liver parenchyma, and the cirrhosis is irreversible process and can be progressed to hepatocellular carcinoma or hepatoma. Most commonly, hepatoma are usually arise on a background of cirrhotic nodule, regenerating nodule with loss of growth control. And hepatoma is not metastasizing usually, and itself hepatoma causing further functional hepatic disease, liver failure. There is a sign or character in diagnosis called blind man diagnosis. Cirrhotic normal liver is smooth, delineated, and not enlarged, with a smooth surface, not non-nodular, whereas cirrhotic liver is shrunken at the latest stages, and the surface is roughened with sensation of nodularity and irregularity on the surface of the liver on an abdominal examination. So it is called blind man's diagnosis, a feature felt by finger palpation. Metastatic cancer, shabab, there are gross appearance or even abdominal examination, especially in thin people, not in abdominal examination, the liver or examination of the liver in metastatic cancer show uninvolved areas, smooth areas in between, scattered nodules, frequent nodules, whereas in cirrhotic liver, the liver is completely replaced by regenerating nodule, one adjacent to the other. So metastatic cancer grossly and by abdominal examination is seen here as a gross. حتى لو بالامتحان مثلا نجيب لكم اياها. This is the difference between metastatic cancer and cirrhotic liver. This is metastatic cancer, يعني مو primary. It is not a hepatocellular carcinoma arising in cirrhotic liver. It is, as you know, the liver is a site for secondary metastasis from ductal carcinoma of the breast or from colonic carcinoma, gastric carcinoma through portal circulation. So the pattern of involvement is spread of differently sized nodules of secondary deposits, metastatic deposits, whereas cirrhosis is replacement of the liver by many or huge number of regenerating nodules surrounding by fibrosis with bulging out of these nodules or regenerating nodules as a result of hyperplasia and regeneration of hepatocytes within a limited space that is restricted or surrounded by thickened, unflexible fibrous tissue, result in this bulging pattern. This is the microscopy of a regenerating nodule or cirrhotic nodule. The thick fibrous band or broad fibrous band are surrounding a group of lobular group of hepatocytes that are hyperplastic, regenerating, trying to replace the damaged hepatocytes with loss of hepatocellular micronodular pattern. Microarchitecture, يعني lobular architecture of of hepatic biopsy اللي سميناها hexagonal lobules are absent or are undetected because of the formation of regenerating nodules. The causes of cirrhosis are many: common, uncommon, treatable but rare, and rare. The most common causes are alcoholic liver disease, cryptogenic or idiopathic without any cause found on investigation, or hepatitis B and C virus infection. Uncommon causes including autoimmune hepatitis and chronic and primary biliary cirrhosis, autoimmune process, chronic biliary obstruction or biliary cirrhosis, and cystic fibrosis. And there are certain metabolic disorders or hereditary metabolic disorders, hemochromatosis and Wilson's disease, and alpha-1 antitrypsin deficiency, galactosemia, glycogenosis type 4, and tyrosinemia. These are metabolic disorders or hereditary or inborn error of metabolism can be associated with cirrhosis. There is a special or a certain summary to remember you about the characteristics or causes of cirrhosis: hepatic, HEPATIC, hemochromatosis, especially primary type, primary hemochromatosis, enzyme deficiency for E, alpha-1 antitrypsin, and other inborn error of metabolism seen in the previous list. Post-hepatic infection or drug-induced hepatitis, infection from outside or drug-induced viral or drug-induced hepatitis. A for alcoholic cirrhosis, T for tyrosinosis or tyrosinemia. Indigenous people in America, or indigenous معناها الأصليين، السكان الأصليين, they have this type of inborn error of metabolism, galactosemia. Cardiac causes, cholestasis, biliary cirrhosis, biliary atresia, cancer, and copper, which is an hereditary or inborn error of metabolism called Wilson's disease. The pathogenesis, regarding the pathogenesis of liver cirrhosis. Normally, the liver interstitial collagen type 1 and 3 are mainly seen in few amount around the portal tract and around the central vein. Bundles and found in the space of dizzy. Occasionally in cirrhosis, the delicate septal tract are formed by the deposition of more type 1 and 3 collagen in the lobules. There will be loss of sinusoidal fenestration because of a lot of collagen deposition within the lobules. The fenestration or opening in between endothelial cells, they will be impaired, so there will be impaired blood flow through the hepatic sinusoids, and also impaired biliary secretion with the continued fibrous deposition, more features of obstruction of the blood flow and retention of biliary secretion. The source of this excess collagen is the perisinusoidal hepatic stellate cells or ETO cells, hepatic stellate cells, or vitamin A storing cells. They are activated to form activated to form fibroblast and myofibroblast-like cells. They are the source of systemic, they are the source of excess collagen synthesis and stimulation. That is in which inflammatory cytokines at the site of inflammation are the source for stimulation of these ETO cells, tumor necrosis factor alpha and transforming growth factor beta and interleukin-1 are the source of formation of stimulation for these cells to lay down more, to be activated and lay down a lot of collagen. Blood delivery and passage of blood through the hepatic sinusoids will be impaired, and also blood delivery to the hepatocyte will be impaired, and the hepatocyte will be stimulated to regenerate within a spherical limited nodule. This will also obliterate the biliary channels and result in backflow of biliary secretion and jaundice formation. The complication behind cirrhosis, there will be reduced hepatocellular function. الفانكشنز اللي قلنا عليها بالبداية protein production, carbohydrate metabolism, protein metabolism, fatty metabolism, decreased synthesis of protein and failure of detoxification of drugs and other ingested material, disturbances of blood flow through the liver causing portal hypertension with all its consequences, portal hypertension, with resultant esophageal varices, hemorrhoids, and dilatation of blood vessels around the umbilicus, that is called capotmedosi. Reduced immunity, immunoglobulin production is reduced and increase the susceptibility of people with cirrhosis to infection, increase the risk of development of hepatocellular carcinoma, due to the uncontrolled or pathway of hepatoma cirrhosis pathway, stimulation of hepatocellular regeneration and damage and repair, increased risk of development of portal vein thrombosis, increase the risk of development of portal vein thrombosis, and due to and even formation of acute liver failure and chronic liver failure, coagulopathy, and all the consequences. The acute liver failure and chronic liver failure acute liver and hepatic failure is the formation or the result of sudden and massive hepatic destruction, or it is the end stage of progressive damage to the liver. Up to 90% of hepatic functional capacity should be lost for diagnosis of hepatic failure. The changes in biopsy or changes in liver tissue, either massive hepatic necrosis due to fulminant viral hepatitis, drug toxicity, or chemicals, combination of toxicity and inflammation and severe hepatocellular destruction. Acute liver failure is development of or loss of hepatic functional capacity within 6 months of the initial diagnosis. Hepatic failure, it is either fulminant within 2 weeks, or it can be also fulminant within 2 weeks, or subfulminant within 3 months. Acetaminophen is a common cause, and autoimmune hepatitis, viral hepatitis are also causes for acute liver failure. The manifestation of acute liver failure is jaundice, development of jaundice, development of hepatic encephalopathy that is related to elevated ammonia, ammonia-related nitrogenous substances, not cleared from the blood, and it will be accumulated, especially in the brain, result in brain edema and impairment of cerebral function. Coagulopathy manifested as bleeding, diathesis, and bleeding tendency, and easily bruising as a result of impaired or production of coagulation or decreased production of coagulation factor. Portal hypertension with all its manifestations and consequences, and even life-threatening upper gastrointestinal bleeding, and hepatorenal syndrome. Hepatorenal syndrome is the development of renal failure secondary to hepatic failure without obvious renal or primary renal disease. The leading cause for chronic liver failure and cirrhosis is hepatitis B viral infection, hepatitis C viral infection, non-alcoholic fatty liver disease, and alcoholic liver disease. So, according to subjective patient factors, for each patient, not all chronic liver disease and cirrhosis, and not all cirrhotic livers led to the stage of liver disease or liver failure. Many passes into stable state, balanced, and with suboptimal state of liver function, and also not all chronic liver disease and cirrhosis. Acute on chronic liver failure, development of decompensated liver function after a well-compensated chronic liver disease, suddenly developed signs of acute liver failure. Liver failure consequences, abnormal liver failure is a series and consequences of abnormal pathophysiologic events. Hepatic encephalopathy as a result of elevated ammonia and associated cerebral edema with the impairment of cerebral function, manifested as loss of consciousness, disturbed consciousness, blurred, and so on. Malnutrition as a result of impaired metabolism of nutrients and defective or decreased production of proteins. Skin spider angiomas are related to decrease the hepatic metabolism of circulating estrogen. Circulating estrogen lead to hyperestrogenemia, which is manifested as spider angiomas, manifested as palmar erythemas in the hand, and also as gynecomastia as a result of hyperestrogenemia, affecting the vascular, presented as vascular lesions. Esophageal varices, splenomegaly, and periumbilical capotmedosi and hemorrhoids are consequences of portal hypertension. Another feature is fetor hepaticus. Fetor hepaticus, due to manifested as an a bad breath odor due to increase in dimethyl sulfide level in the blood, also associated with jaundice and cellular related to decreased ability to metabolize, excrete, and bilirubin, with the resultant increase in the level of unconjugated bilirubin in the blood. Testicular atrophy is also a feature or manifestation of chronic liver disease, and liver cirrhosis also. This is the effect of vascular lesions of decreased hormonal metabolism, especially hyperestrogenemia, in which there is dilatation in the skin vessels seen are called spider angiomas. Central arteriole surrounded by small vessels, distended vessels. Transaminases, AST, ALT, also known as SGOT, SGPT, and lactate dehydrogenase are hepatic intracellular enzymes that indicate hepatocellular damage, whereas alkaline phosphatase, gamma-glutamine transpeptidase, and 5-nucleotidase are membrane-associated enzymes and are indicative of bile stasis or biliary obstruction. These are common signs of liver diseases, summarized as A, B, C, D, E, F, G, H, I, J. A for astraxia. Astraxia is flapping tremor, or called liver tremor, hepatic tremor of the hand with wrist extension. Ascites also due to decreased osmotic pressure, accumulation of peritoneal fluid. Ankle edema is also related to decreased hepatic albumin production. Testicular atrophy due to hyperestrogenemia. Bruising, easily bruising and bleeding as a result of decreased production of coagulation factor. Clubbing fingers, sign of chronic disease, and leukonychia, change in whitish discoloration of the nails. Debutine contracture or abnormality of the tendons or muscles here. Encephalopathy, E for encephalopathy, and palmar erythema, E. Fetor hepaticus, that is bad odor of the mouth due to increased sulfide salts, dimethyl sulfides in the blood, and gynecomastia as a result of hyperestrogenemia, abnormal metabolism of estrogen hormone. Hepatomegaly, and increased size of carotids. The size of carotid are increased in cirrhotic patient or chronic liver disease. This is seen mainly in alcoholic patients, and this is a manifestation seen in chronically alcoholic patient, in which there is increase in the amount of fatty tissue rather than the acinar component of the parotid tissue. Jaundice is whitish discoloration due to elevated serum bilirubin. The liver function is severely impaired in chronic liver disease with or without cirrhosis, and two complications are important. extrahepatic or systemic involvement, hepatic encephalopathy, and hepatorenal syndrome. Hepatic encephalopathy and hepatorenal syndrome. Hepatic encephalopathy manifested as disturbances in consciousness, fluctuating neurological signs due to abnormal neurotransmission in the central nervous system, related to elevated ammonia, which impair neuronal function and promote generalized brain edema. So generalized brain edema related to elevated serum ammonia and accumulation within the brain substance and functional cerebral and cerebral functional defects. Hepatorenal syndrome, appearance of signs of acute renal failure and severe liver disease with no intrinsic or endogenous cause of renal failure. And thank you. شكرا على الإصغاء، شكرا آسفة على الإطالة. إذا أكو سؤال شباب، أكو سؤال شباب؟
لا شكرا دكتورة.
تمام.